Hi everyone, my name is Annie Catherine Zuze, and with me here I have an environmental health student, a student at Eden University. Sir, would you kindly introduce yourself?
Yes, my name is Boniface Cello. I study environmental health here at Eden University, and I'm in my second year, first semester. Yes.
All right, sir. We're just here to talk about environmental health, what environmental health is all about. We want to have a broad understanding about environmental health. So we would appreciate if you would kindly tell us more about what environmental health is.
Okay. So environmental health, by the word itself, is the study of the environment.
Okay.
But here at Eden University and as a profession, we study about what the environment has to do with our health. So we just don't study about weather, about trees. We also study about these components of the environment and how they affect human health.
So we would like to know what actually prompted you, or rather forced you, to pursue a career in environmental health.
First of all, I never even knew it was a profession, to be honest with you. I found out from my friend's father, and I was at my lowest. I wanted to do agriculture. Now my friend's father was an environmentalist, and this time when we were arguing with my friend, he was actually telling me about what his father does. It was a sad story, if you ask me, but let me just say the end goal became, instead of me doing agriculture, I got so interested in environmental health to the point I had to join the profession.
Okay. So we hear of environmental health having pillars and all that. So we'd just like you to share more on that.
Oh yeah. The pillars of environmental health, they're just it's the core elements that govern environmental health. What are the aspects that we are looking at here? So these are like built environment.
Right.
So built environment is just the buildings that surround us and their impacts to human health, right? And we've got food safety. It's just another aspect that we look at on how the food affects human health, right? We've got community health, and this is when people see us moving in the community, educating about malaria control. Yes, that's part of it. We look at how in the communities we are living, what are the challenges we are facing. So environmental health, I've said three actually. There are five. There is also occupational health. So occupational health is just how does someone's job or what they do for a living affect their health, right? And the last one is pollution control. We study pollution control in order to keep a sound environment, because pollution itself can damage the environment.
Okay, so there is this notion of saying environmental health is basically for the local government, like Vama Bin, solid waste handlers. So what is your take on that?
Actually, that notion, even here at the university, there are people who are doing other programs who look at us like, those are the garbage collectors. No, as you can see the way I'm dressing right here, this is the way we normally dress. Although you can find me in a work suit, that just says I'm going to work somewhere where I need safety.
All right.
So now, about the local government thing, we are the overseers in terms of the environment. So things like pollution control, we are not necessarily the garbage collectors, but it's our responsibility to ensure that garbage is collected and disposed of in the right way. So we are not the collectors, but we are the ones who are responsible for it. Yes.
So in the context of solid waste, what is it all about?
Oh, so solid waste is just, let's just make it very simple for someone to understand. It's just the things that we are no longer using, then we throw them away. And you hear the solid in it. We're not talking about liquids here. We're talking about things of substance. For example, this mic breaks down, you throw it away, this solid waste. So now, what solid waste is, it's just these are daily objects that people are using and the use is done, so they throw it away. Yes, so that's what solid waste is all about.
All right, so you are a student at Eden University, right?
Yes, yes.
So what knowledge are your lecturers equipping you with that is transforming you into becoming a better inspector one day?
There's actually a lot that I can say, but like one of the main things here at Eden University, the first thing is the dress code. Let me just talk about this. In my university, it's not like the rest of these. If you are doing environmental health, you need to look the part.
All right.
So when I came here first, it was hard to fit in a necktie every time, but it eventually became something that like we are now used to. It's a thing. They want us to be representable. You understand? And our school, when it comes to knowledge itself, they give us these practical, let me just say practical activities where we go out. Like last week? I think we went to one of the dam sites in Lusaka.
Okay.
We went there not necessarily to learn, but that was the core business. But we went there to kind of see what we're about to do. You know, there's this whole thing of if you sit in a class, the only thing you know are the words, but if you go out there, you know what you're doing. So our university has actually made it very easy for us to learn about our profession at an early stage, unlike the others who just go for these trips in the outdoors later on in their career.
Okay, so Mr. Boniface, I would like you to tell me, since I've already asked you a question concerning what you've learned from the institution or what the institution is equipping you with.
Yes.
So I would love you to tell me any 3 lessons or quotes that you've learned from your top 3 lecturers, and I would love you to mention those lecturers.
First of all, big shout out to my 3 favorite lecturers. Okay. So my 3 favorite, there is Mr. Msoni,
okay,
Mr. Zulu, and Mr. Makombe. So I start with Mr. Zulu. Mr. Zulu always taught us, he never used to teach us in a direct way. He always taught us lessons in a very indirect way. He used to have this saying, my uncle. Every time he's teaching about any disease, he would relate it to his uncle. At first, it was a funny thing because this man has all his uncles sick with all the STIs. You can just imagine that. But later on, we actually came to realize that we never forgot what the disease was all about, because we always used to laugh at it that Mr. Zulu has an uncle with this thing. You understand?
Yeah.
Then Mr. Msoni. Mr. Msoni, he's one man who's very friendly. I mean, this is just between me and you. This man doesn't need to hear this. He's very friendly, but when you meet him, he looks like the toughest person you've ever seen. Mainly because he's got all of these principles that he expects you to live up to.
All right.
Like the first time in his class, you just arrive there, maybe with half your necktie on. You know what I mean? You just walk in and just look at you. Go out. You are not ready to learn. You get me?
Yeah.
So Mr. Msoni, he's like a big player when it comes to accountability. Among most of the environmentalists who we can interview at Eden University, they will tell you that anything that deals with accountability and discipline is Mr. Msoni. And I would actually say the same about Mr. Makombe, although Mr. Makombe, it's a little bit more than that, because I feel like if you're a student at Eden University, once or twice Mr. Makombe has dealt with you before. Mainly because Mr. Makombe and Mr. Msoni are 2 lecturers who, they really care about their students, and when you meet them, like first impression, you feel like these guys are just trying to be jerks. But they teach us about accountability, responsibility. I feel like all the core elements of being a real inspector, in terms of the respect, comes from these 2.
As an EHT, or actually an inspector in training,
Yes.
what household solid waste management skills would you give to many people out there that deal with everyday solid waste?
That's a really good question. That's a really good question.
Yeah.
So, out there, I would like people, first of all, first thing that we can't stress enough, it's waste segregation. So, waste segregation, first of all, is just separating your waste. This is one of the things that communities do not understand, but it's very vital because we face a lot of challenges as inspectors, environmentalists, in terms of people don't separate their waste. You can go to this, let's just say you go to a market. Maybe you want to collect the waste there with the local council, right? And maybe some workers. People would throw injections in the same waste. They throw sanitary towels in there. They throw each and everything, to the point waste now is so hazardous and it's hard to actually dispose of, because how can I take injections to the dump site? The people there maybe who are working to ensure that the waste is properly managed, that can put them at risk, right? So in households, separate your wastes. Know what waste to put where. Don't just put everything. So I would actually also encourage one more thing that's kind of together with waste separation. It's what to do with your waste, especially waste like shima, food. So these things are biodegradable, meaning they can be decomposed, right?
Yes.
So now, separating those things, you can easily use them for manure. Put them in a garden and you have proper vegetation in the surrounding. It's a thing of not everything has to be taken to a dump site, because some things are really important for the environment. So if now households are separating their wastes and food particles are also used in the gardens, I feel like that can be a very good thing in Zambia. So if people know what to do with their wastes, that can be it can be really helpful, not just for us environmentalists, but for the whole environment.
Right, Mr. Boniface, I think I heard you talk about waste segregation, right?
Yes.
Then you said it's not everything that you're able to take to the dump site, such as needles and all that. So where do those, or how do you dispose of needles?
All right. So when it comes to needles, although I will say needles and other things that are, let's just say, hospital related. So these things, they have their own proper way of disposal. In hospitals, we have what we call incinerators. So for those of you who do not know what an incinerator is, it's just an incinerator is just kind of like a facility that's built to burn the waste that's in hospitals, right? So those things need to be taken there, mainly because those are the places, like we get to burn it. We don't, it does not put anyone at risk because we incinerate it, right?
We really appreciate Mr. Boniface for having you here. I've learned a lot actually myself. I've learned about the 5 pillars of environmental health, what environmental health is all about. So what would be your message to people out there that would like to pursue either a degree or diploma in environmental health?
To the people out there, it's not all about waste. It's not about us picking the waste, because that's the common notion, right? It gets you exposed to these concepts that make you very much aware of how to treat waste. It teaches you a lot, and there's a lot of opportunities within environmental health. You can create a consultation company, you can work for the local government, you can even work for the airports, anywhere. Like, you can work in a lot of places, and it's a really good thing, not just as a program, but also we can even put it as an art, because it's an art. Yes.
It was really nice having you, Mr. Boniface. So we've learned a lot. I'm sure even the viewers out there have learned so much from you, as I have.